Senator Hassan.
Well, thank you, Mr. Chair, and to both of our nominees. First, thank you and your families for your service, and congratulations on your nominations, and a special thanks to the families, because you both stepping up to do this work will be a test for them as well, and we're very, very grateful to you. And as Senator King and Senator Sheehy just said, we are all united here in serving veterans. And Mr. Workman, you and I talked about my dad served in World War II, your grandfather, and that was a really good discussion. And as I said, my father, having survived the Battle of the Bulge, I never heard him complain about a thing afterwards. Just a remarkable member of the greatest generation. But I also just want to address Senator Sheehy and I would agree that community care is important. New Hampshire is the only state in the contiguous U.S. that doesn't have its own VA hospital, so community care has been very important. I would also say that some of the statistics that Senator Sheehy was talking about happened during the time when we passed and instituted the PACT Act. So there are a lot more people coming into the VA for health care. It was a big surge, and we still have work to do to implement the PACT Act effectively. And I'm also concerned because our community care in New Hampshire and across the country is also struggling. So to suggest that just by referring veterans to our community civilian healthcare system is going to solve their access to care problem, I think ignores the challenges that our community system, our civilian system, is going to have, especially in light of the reconciliation bill, the big, beautiful bill that is what President Trump calls it. That's going to strain our rural care even more. So I want us to all think about that in that context. I want us all to think about Senator King's concern about the way these contracts were canceled. It's just, the way I think about it is, good carpenters measure twice and cut once. And it seems to me that the VA went about this backwards. So I'll get to my questions now, but I just wanted to kind of level set us a little bit as I listen to the exchanges we've been going on. I am asking every nominee these days a straightforward question, and I'll start with you, Mr. Bartrum, and then you, Mr. Workman. If directed by the President to take an action that would break the law, would you follow the law or follow the President's directive? Mr. Bartrum.
I don't anticipate ever being asked to break the law, but I follow the law.
Thank you, and I should have said General Bartrum.
That's okay.
Sorry, Mr. Workman.
Likewise, I don't anticipate the President asking me to break the law, but I would always follow the law.
Well, I appreciate your commitment to following the law. I'd suggest that you review some of the things the President and his administration have done and consider the first part of your answer. Mr. Workman, I'd like to discuss an issue that I know we both care about a lot, ensuring that our nation fully supports the surviving families of our fallen heroes. I've been working with Senator Cassidy on a bipartisan bill that would help Gold Star and surviving spouses get employment assistance through DOL Vets, the office that you're nominated to lead. I'd like to work with you on this issue because I think we owe it to the families of the fallen to do everything that we can to support them and help them move forward. That's a debt we owe to those who sacrifice so much for our nation. Given your military experience, sir, can you talk to me about some of the sacrifices that military families make and the importance of supporting them, especially surviving spouses?
Yes, thank you for the question, Senator, and I do appreciate you taking that meeting with me. That was special to be able to look through that, your father's diary, and yeah. I appreciate that. But getting back to our Gold Star families, we owe these folks more than what, we owe them everything. Yeah. My wife, Jessica, is sitting right behind me. She could be the first one to tell you that staying at home while we are overseas doing our nation's work is, like I said in my opening statement, it's one of the toughest jobs in the military. Yeah. We owe these folks everything that we have to offer, and if confirmed, I look forward to working with your office and providing technical assistance with.
Well, thank you. That's what I was going to ask, if you'd commit to working with us on this bill, and I look forward to working with you on that too. General Bartrum, in May, the President issued an executive order requiring the Secretary of the VA to create an action plan to support a full-service medical center in New Hampshire so that we're no longer that only state in the contiguous U.S. without a full-service VA hospital. I have long supported bringing a full-service hospital to New Hampshire, and I want to make sure that the VA is engaging with Granite Staters at every step of the way. If confirmed to be the VA's Undersecretary for Health, how will you work with New Hampshire veterans and our congressional delegation as the VA creates its plan for a full-service hospital in New Hampshire?
Senator, I can certainly assure you that I would work with you and the state on that. We have already started a site survey process where we start the initial part of the site survey, and then that will, down the road, that will have a process where we engage with the state as we look at what we see as the need, capabilities, and capacities that are there, and to work with the state on what right looks like as we move forward.
Well, I appreciate that. We have, understandably, like I think probably in every state, a very active group of veterans in New Hampshire. As you both have commented, veterans never stop the mission to serve, and that's true in New Hampshire as it is everywhere else. And they really want to engage directly with the VA about how to make this a successful planning scenario. So thank you, sir.